Oh, sorry, Senator Moloney.
Thank you, Cathaoirleach, and thank you, Senator Higgins, for allowing me to come in again on this. As you know, Minister, this was the subject of an adjournment debate I did here a couple of months ago, and I just wanted to reiterate my call on you today to revisit the whole situation for cancer sufferers. You know yourself that when you are diagnosed, the word cancer drives terror into the hearts of people, and the fact that they're fearful that they won't be able to provide the medication necessary to help them to overcome this terrible illness, and it is a great worry to people. As you know, the guidelines for medical cards are so low that people on an average industrial wage or low-income families just don't qualify unless they have a mortgage or something to offset it. So they are very, very concerned and very worried. And this has kind of escalated over the summer, where people have found that they were unable to, they're terrified they're unable to afford the medication. And in your reply to me last time, you did say that there were a lot of other illnesses that would have to be looked at as well if we looked at cancer. But a lot of the very bad illnesses are considered long-term, and they have a long-term illness card, whereas cancer sufferers don't. So, Minister, again, I would ask you to revisit this and perhaps to give a directive to the Medical Card Office to make sure that all cancer sufferers are looked after with a medical card. Thank you. Thank you, Senator.
Thank you very much. I thank Senator Higgins initially, and also Senator Moloney for their contribution on this issue of concern to them. As the senators will be aware, under the provisions of the Health Act 1970, the assessment for a medical card is determined primarily by reference to the means, including the income and expenditure of the applicant and his or her partner and dependents. People with specific illnesses such as cancer are not automatically entitled to medical cards, and that is the legal position since 1970. And it wouldn't be possible for this minister or any minister to issue a directive to change that position. It would have to be a new piece of legislation passed by the Oireachtas, because this is actually the law that the Oireachtas passed back in 1970, that the basis for obtaining a medical card is done on foot of an assessment of your means. And that's what the law provides. I understand the point that Senator Moloney makes, but it's not something that's amenable to being changed by ministerial directive. It simply couldn't be done by ministerial directive. The law, the Act of 1970, would have to be amended, would have to be changed. That having been said, there is a discretion by the HSE to grant a medical card where a person's income exceeds the income guidelines. But it's still done on the basis of, the discretion obviously has to be exercised by the HSE, but the fundamental provision in the 1970 Act is that you're assessed on the basis of your means, and the question asked is, can you provide for your own health care, I don't have the Act in front of me, treatment and health care without undue hardship. The discretion is there to deal with, or the opportunity for the exercise of discretion is there to deal with the kinds of cases that Senator Moloney and Senator Higgins indeed have raised, which is people who are above the income limits but who are still facing genuine hardship in terms of providing for themselves. It still can't be done on the basis of somebody having an illness. And I'm always conscious, Cathaoirleach, of how harsh this sounds for a minister to say, we don't give medical cards to people just on the basis of an illness. It's a very hard, crude way of answering the question that's put. But I'm simply just, I suppose, setting out for the benefit of the House again what the law actually provides. That is what the law provides. That there isn't a basis for giving medical cards or extending medical cards to a citizen on the basis of their having a particular illness. That is not the current state of the law. And if we were to change it, it would have to be done by legislation. And I do have a commitment, and this government has a commitment set out in the programme for government, for universal access to a free GP service, which, of course, I would accept is not the full GMS, but it is a free GP service for the entire population. And the entire population of people, whether they're well or whether they're ill. We want to have everybody having access to a free GP service so that we develop primary care and do all of the things in primary care that we need to do in this country in terms of identifying that area of healthcare which is closest to where the person lives and where they are, that they should be treated and should have available to them treatment in the community, and that we have all the preventive strategies that we need to have in the health service that we haven't had sufficiently well developed, so that we can actually involve people and assist people and encourage people in terms of right across the board, not just as I say when they're ill, although obviously that's the most sensitive and the most difficult time that people have. I do point out again, not for a moment to take from anything that the senators have said, have to point out that you know, and it may be true what Senator Moloney says, that the guidelines are so low, but 43% of the population actually satisfy the guidelines. No, medical cards have now extended to 43% of the entire population. So I suppose that's a statement of how, you might say, of how generally incomes have been affected as a result of the recession, that so many of the population actually can satisfy these, what you describe as very low figures. That's a description of the situation that we are in the country. No, absolutely not, on the contrary. But in relation to discretionary medical cards, if I may, I know I've extended myself time a little bit. In relation to medical cards which are extended on a discretionary basis, social and medical issues are considered when determining whether or not undue hardship exists for an individual accessing GP or other medical services. This, even where they are above the income guidelines, they can apply to be dealt with under the discretion which is available to be exercised. That discretion will be applied automatically during the processing of the application, where additional information has been provided which can be considered by staff or a medical officer where appropriate. At Minister James Riley's request, the HSE set up a clinical panel to assist in the processing of applications for discretionary medical cards, where a person exceeds the income guidelines, as I've said, but where there are difficult personal circumstances such as an illness. The community medical officer reviews and interprets medical information provided by the applicant on a confidential basis. They then liaise with GPs, hospital consultants, and other healthcare professionals as appropriate, so as to determine the health needs of the applicant and his or her family or dependents. The community medical officer then applies discretion within the guidelines to determine if the applicant is suffering from medical hardship. It's important to stress that the medical card system is founded on the undue hardship test, as I've mentioned. The Health Act 1970 provides for medical cards on the basis of means. That is what the law states, as I've indicated. We can't go outside. No minister can go outside the parameters, the legal parameters that are set out. The discretionary system, I suppose, then you could best describe it as an exception to the general rule that you have to actually satisfy the income limits. The HSE also has a system in place in relation to the provision of emergency medical cards for patients who are terminally ill or who are seriously ill and in urgent need of medical care that they cannot afford. Emergency medical cards are issued within 24 hours of receipt of the required patient details. With the exception of these of terminally ill patients in palliative care, all emergency cards are issued for 6 months on the basis that the patient is eligible for a medical card on the basis of means or undue hardship, and will follow up with a full application within a number of weeks of receiving the emergency card. Where a patient is terminally ill in palliative care, the nature of the terminal illness is not a deciding factor in the issue of an emergency medical card in these circumstances, and no means test applies. Given the nature and the urgency of the issue, the HSE has appropriate escalation routes to ensure that the person gets the card as quickly as possible. Thank you.